Oh yeah.
It's a virus that, humans have known about and identified in the late 50s. Just by way of a little history, because I think it's kind of interesting. This virus really has a reservoir in nature in rodents in Africa, really in Western Africa and the Congo region. And when we say a virus has a reservoir, it means those rodents are carrying the virus, but they're really not getting sick from it. They're just running around doing their thing. And there were several research monkeys being housed in that part of the world. And their cages were outside, and the rodents did give these research monkeys their pox virus, their orthopox virus. And the monkey handlers subsequently also got the pox virus from the research monkeys. And that first episode was in 1958. And since then, it's been identified and called monkeypox. And we've had low levels every year globally. It's almost been exclusive to the African subcontinent, though. We really don't see monkeypox outside of where that natural known reservoir has been. Every now and then we've seen little outbreaks, but this most recent outbreak really flared in, it looks like it really kind of kicked off in Europe way back in the early spring. And, we started the conversation with COVID. I think one of the really impressive lessons that we learned from COVID is that we are all one big community, and it's a global community. So this virus that usually lives in Africa made a break for it in the 1950s. We've never really gotten it back down to zero. And this current flare really is the result of high transmission in Europe back in the early spring. And we have global travel, and the way this virus is spread is through a universal behavior that we're going to get to, I think, in just a little bit, but it has been spreading. So in the US, we've had many, many, many years of zero monkeypox cases, and started, with 10s and 20 cases in California and New York. And we're now north of 10,000 cases known in the country at this point in time. And it's August now. This virus was first identified in Europe back in, late March, early April. So I think that speaks to the log acceleration of how it's been spreading, and also points to why it's been called, an emergency, a public health emergency.